Hi, so today we're going to look at the anatomy of your spine. I want you to just take a couple of seconds to think about what it is that makes up our spine, what different structures we have around our spine. So to begin with, then we have bone. We have lots of different vertebrae that make up our spine. We have lots and lots of muscles that surround our spine as well. We have lots of nerves that sit around our spine as well as our spinal cord. We have ligaments and we have discs. So to begin with, we look at the shape of our spine. Our spine is a gentle S shape. Our spine is divided into 4 different sections. At the top, we have our cervical spine that's made up of 7 different vertebrae. We then in the middle have our thoracic spine that's made up of 12 vertebrae. We have our lumbar spine at the bottom that's made up of 5 vertebrae. And at the base then we have what we call our sacrum, which is a fused block of bone with our coccyx sat right at the end. Each of these vertebrae are given a name. So your cervical vertebrae start with a C and then are numbered from 1 at the top down to 7 at the bottom. Your thoracic spine is given T and T1 at the top, T down 12 at the bottom, and L1 at the top for your lumbar spine and L5 at the bottom before becoming S1 in your sacrum. The discs are referred to by the vertebrae that they sit in between. So your L4-5 disc will be the disc that sits in between your 4th and 5th lumbar vertebrae. The degree of spine, say, varies from one person to the next. We're all different shapes, different sizes, and so the degree of spinal curvature that we have will vary. There is no picture perfect. Bones have a very different couple of roles within our spine. Bone is very important in terms of protection of important structures in our body. So if we think about the major structures that we need to protect, our brain, for instance, is protected by our skull. Our heart and our lungs are protected by our rib cage. And our spinal cord is no different. It needs protecting because it's an important structure and it is therefore well protected by our spine. We have 206 different bones in our body and they offer support and structure for our body. They give us our body, our shape. They also absorb pressure, so they change in response to load. The more load we put through a bone, the stronger it gets. The less load we put through a bone, the weaker it gets. And these days, if you break your leg, that's why we possible instead of in the days gone by where you'd have been on bed rest for a few weeks. Equally, astronauts, when they're floating around in space, they will lose some of their bone density. And so it's really important that they continue to do weight-bearing exercises even when up in space in order to try and stop their bones getting weaker because they haven't got the effects of gravity on them. Bones are covered in a sensitive layer of nerves, and you'll know this if you've walked into a coffee table or you've bashed your elbow. Again, it's the nerves are covered in this sensitive layer of little tiny nerves. Facet joints give us movement in our spine. We have a facet joint on the left and on the right of each level of our spine, and they allow us the flexibility. So while still protecting that spinal cord, they allow our spine to bend. As we lean forwards, those facet joints will open up. As we lean backwards, those close down on each other. The joint surfaces are covered by a fluid called synovial fluid that helps to lubricate the joint. The more we move, the more we promote the production of that fluid. So again, keeping active is important. Joints can get stiff and restricted if we stop moving them. And often it's the movement of these joints is where when we hear noises, and that is just the fluid moving between the joint surfaces. So it's nothing to worry about. It's perfectly normal. And actually we want fluid moving around a joint because that helps to lubricate it. So any clicking or cracking is generally just the fluid moving between those joint surfaces, and sometimes little bubbles can form and pop, and that's what can make those noises. Discs are very important in our spine. They have a role within shock absorption. Discs are made up of about 70% water. They're quite fluid and dynamic structures, and that helps to absorb shock. So if we're walking or running, that helps to absorb some of those forces. They also provide our spine with more flexibility. Again, the high water content allows them to move around nicely, and they help to provide our spine with that fluidity. They're firmly situated between the vertebrae. They can't move anywhere. They've got a nucleus in the middle, which is made up of a sort of a gel-like substance, and then tough ligament rings around the outside. As we get older, a natural process is that water content will decrease. There's nothing we can do about it, but it's a bit like getting grey hair and wrinkles. It's an inevitable part of aging. That will happen to each of us at slightly different speeds and slightly different rates, but it's a natural process, and that's why we get a little bit shorter throughout our lives. We will also lose a little bit of height through the day as we're stood, and overnight then as we lie flat, our discs will reabsorb some of that water and we will regain some of that height, but over time it does slowly decrease. Sometimes this is called degenerative disc disease, but it really just describes a natural process that happens to everyone. Discs can't be out. They can, however, bulge if we hair or pressure from in the middle can start to cause the disc to bulge. That does have the potential to heal, although can take quite some time. And if you have a scan again later on down the line, sometimes it can show an improvement in the situation. Muscles are important structures in our spine. They allow for movement, but also support. So muscles will help move one movement, but equally they will also work to keep me upright against gravity. So if I'm stood or sat, I will have muscles working to keep me in that position. They also have a role within protection, so abdominal organs, I've got my abdominal muscles covering those, which will provide some level of protection. Pain can have different effects on muscles. It can cause some muscles to tighten up. It can cause other muscles to switch off and get a bit lazy. So muscles will respond to pain in different ways. And that's why sometimes things can go into spasm, or things can just get a bit weaker over time because it's not switching on in the way that it normally should. Pain can cause us to move in different ways, which can cause us to use muscles in ways that we might not have used them in before. Muscles have the potential to heal quite quickly because of a good blood supply, and that's why they're red in colour, because of that high level of blood supply. Nerves are very important structures in our body. We've got hundreds of meters throughout our body, and they carry messages to our brain from the rest of our body, but also carry messages from our brain back out to the rest of our body. So for instance, in order to make a muscle contract, it will be a message from the brain down to that muscle to get it to move. They're highly sensitive structures, so if you ever lay on your arm and it started to go a bit numb and tingly, it's because you're disrupting the nutrition to that nerve and it starts to get a bit grumpy. You're not damaging it at that point, but it's purely just the fact that you're reducing its nutrition. They're very tough and strong. They're made up of about 50% ligaments, so very tough, and they need to be in order to withstand the stretch and movement as we move around through the day. They can be activated by lots of different activities and inputs, but for instance, cutting or squeezing, pulling, different chemicals can set them off, a reduced blood supply, and different temperatures as well can activate those nerve endings too. Finally, ligaments. Ligaments act around joints to prevent unwanted movement, but allow other movement. So for instance, if you think about your elbow and your knee, you want your knee to move forwards and backwards, but you don't want your knee to move side to side. So you've got ligaments either side of your knee to try and prevent that unwanted movement whilst allowing movement forwards and backwards. And the same goes for your fingers. You want movement forwards and backwards side, so ligaments help restrain that. That happens with all your joints, so your shoulders, for instance, have a high degree of movement, but you still need some support and some restraint from your ligaments. We've got lots of ligaments throughout our spine, because of the number of vertebrae that we have, and those ligaments help to keep our spine nice and strong and nice and stable. It's important to think about our posture at times when we're doing certain activities. It's not bad to slouch or to bend. However, it's important not to spend too long in these positions, but the same goes for sitting bolt upright as well. It's about variation in movement rather than one position being particularly bad.